Hello, everyone, and welcome. Now, if you're a healthcare professional or a psychologist, you're always looking for ways to improve patient care. Today, we're diving into something that's absolutely critical, but, let's be honest, often gets pushed to the side. We're talking about restoring sexual well-being after stoma surgery, and we'll be drawing on some really insightful material from researchers like Dr. Abdul Karim.
Just listen to this. This quote from a patient. Wow, it just cuts right to the heart of the matter, doesn't it? It's not just a sentence. It's a plea for a real, honest conversation and a total rejection of those empty, everything will be fine reassurances. It tells us exactly what our patients are feeling, that deep anxiety, and why we, as their care providers, have got to find a better way to talk about this.
All right, so here's our game plan. First, we're going to look at just how big this silent struggle really is. Then, we'll dig into the why, the psychology behind it all. After that, we'll get practical with a framework for conversation, show you how to use it, and wrap up by looking at what truly holistic care looks like.
Okay, let's start by getting a handle on the sheer scale of this. And I want to be really clear, this is not some niche issue for a handful of patients. The data is loud and clear. Sexual dysfunction after stoma surgery is a massive, measurable challenge, and it's one we absolutely have to face.
You know, when you look at this from a broader health perspective, it's so obvious. This isn't just one isolated problem. A disruption to sexual well-being, it's like a trigger. It can kickstart or seriously worsen things like depression and anxiety. And what happens then? People pull away, they socially isolate, and their quality of life just plummets.
And just look at these numbers. I mean, they're staggering. The research shows that up to 88% of men and 75% of women experience sexual dysfunction after their surgery. Let that sink in. This isn't the exception. For our patients, this is pretty much the rule.
So here's where we see that critical link between the physical body and the mind. Almost half of all patients, we're talking 47.7%, say they're dissatisfied with their body image. See, this isn't just about the surgery itself, right? It's about a massive shift in how they see themselves, and that is right at the very heart of their struggle.
Okay, so we've seen the what in the data. Now let's really dig in and go beyond the pouch to understand the why. What's really going on for these patients?
And our goal here, it's got to be bigger than just fixing a dysfunction. It's about restoring what we call sexual well-being, or SWB, and that's a much bigger idea. It's about feeling safe, respected, confident, secure, all these incredibly important emotional states. It completely shifts our focus from just a mechanical problem to a deeply human one.
So what's the key takeaway here? It's this. Body image is the bridge. Think of it as the psychological connection between the physical change of the stoma and how it impacts a person's sexual life. So if we really want to help our patients, we have to start right there with that core issue of how they see themselves.
You know, patients often go through a kind of psychological journey after surgery. It usually starts with shock, this feeling that the stoma is an alien body. Then they move into a phase of hiding and protecting it, maybe avoiding looking in the mirror, definitely avoiding intimacy. And then, hopefully, they start a process of renegotiation where they start to accept it. But some can get stuck. And knowing these phases, well, that's how we meet them where they're at.
So what's driving all of this distress about their body image? It's not vague stuff. It's really specific, very real fears. The fear of the pouch leaking during intimacy, the worry about odors or gas, that deep, gut-wrenching feeling of being physically broken, and maybe the biggest one of all, the fear that their partner will be disgusted or reject them. These are the real walls we need to help them climb over. Okay, we've spent some time really defining the problem, so now let's talk about the solution. I want to introduce you to a proven, practical tool that you can literally start using tomorrow to open up this incredibly difficult but essential conversation. It's called the Plicit model. It's a really simple 4-level framework that helps guide these conversations. It goes like this. P is for permission, L is for limited information, SS is for specific suggestions, and IT is for intensive therapy. See, it's a tiered approach, which means any one of us can start the conversation at that first level. And here is the single most incredible thing about this model. Are you ready for this? Research shows that for 80 to 90% of patients, their concerns can be resolved at that very first step, just permission. Seriously, just by opening the door, telling them their feelings are normal, and letting them know it's a safe topic, that act alone can be a game changer. Okay, so that sounds great in theory, but how do we actually do this in a busy clinic, right? Well, let's get into a practical toolkit.
We're going to break down each level and give you some specific phrases you can use with your very next patient.
All right, let's walk through this. For P, permission, your goal is just to validate their concerns. Something as simple as, many of my patients have questions about intimacy after this surgery. What's on your mind? That's it. It normalizes it. Then, for LI, limited information. You give them basic, reassuring facts. For example, the stoma itself doesn't have nerve endings, so sexual activity won't hurt it. For SS, specific suggestions, you can offer practical advice, like, have you thought about trying smaller pouches or decorative covers for intimacy? And finally, for IT, intensive therapy, if the issues are deeper, you have a plan. These are really important concerns, and I can refer you to a specialized therapist who can help. It gives you a roadmap for the whole conversation.
So, using the Plicit model is a huge step for any one of us to take. But if we want to create real, lasting change, we need to build this thinking into our entire system of care. So, in this last section, let's look at the key shifts we need to make to provide truly holistic care.
And here's the really encouraging part. This doesn't mean we have to completely overhaul everything. The research is so clear on this. It's the small, consistent changes, the things we weave into our everyday practice, that can totally transform a patient's long-term quality of life.
So, here's what that checklist for change looks like. Number 1, universal preoperative stoma sighting, thinking about body image before the surgery. 2, making Plicit counseling a routine part of care. 3, a dyadic focus, which is just a fancy way of saying include the partner in the conversation. 4, checking in on sexual health over the long term, not just one time. And finally, 5, making sure we have those multidisciplinary referral networks set up and ready to go.
I really want to leave you with this idea, because it can completely shift how we see our work. We have to reframe this. Stoma surgery is not just a GI procedure, it is a sexual health intervention. And because it is, it deserves the exact same systematic attention we give to things like continence or nutritional outcomes. It's that important.
So, I'm going to leave you with a practical question to take with you. Based on everything we've talked about, how are you, yes, you, going to create that space, that moment of permission in your very next patient encounter? Because that simple 2-minute conversation, it might just be the most important thing you do for that patient all day.